Associate Professor at Osmania Medical College, Department of Anaesthesia, and is a past President ISA Telangana and a Joint Secretary ISA Telangana State. His areas of interest are ultrasound in regional and in anesthesia and invasive procedures, and use of ultrasound in ICU and difficult airway management. He has conducted a difficult airway workshop, mechanical ventilation at state conference. I welcome Dr. Venkateswara Rao.
Good afternoon all. Thank you, madam, for your kind introduction. And outside, I would like to thank organizers for giving this opportunity to stand here. This is the pointer.
This pointer.
Sorry. My topic is regional anesthesia and PCNL surgeries. Regional anesthesia is always a debating in, especially in PCNL surgeries, maybe because of his positions and everything. And my seniors and my teachers told you that regional anesthesia is always a bread and butter to us. Actually, we should be very perfect in regional anesthesia. Definitely. This is the PCNL, what generally the urologists do in a prone position. They will use a lithotripter and they will break the stone and they will use irrigating fluid and they will wash it out and they will put a stent. So it is a gold standard treatment for the renal calculus when there is a limitation for the extracorporeal shockwave lithotripsy, and this is a choice of modality in large multiple SZISACON calculuses. Coming to the history, it's not important, but in 85 it was initially started, that nephrostomy, and then later on in 1955, Goodwin and colleagues published their landmark report on therapeutic percutaneous nephrostomy, and in 1976, Fenstrom and Johnson reported the retrieval of the renal stones through the nephrostomy and subcutaneously. As the incidence of renal calculus is increasing and the number of PCNL surgeries is also increased, initially all PCNL surgeries was done in general anesthesia, and maybe because of that prone position or irrigation fluid they are using and the time they are taking for this general anesthesia and other technical issues, people are thinking that why can't we do in the regional anesthesia? So in that thought process, in 1988, the first reported regional anesthesia was done for the PCNL. So whatever may be the procedure generally we will choose, it will be depend upon the utmost important is the patient safety. Comfort is always important, and his consent. What is the surgeries, what is the mode of anesthesia is going to be. And is our friend surgeon, his comfort is also utmost important, definitely. Otherwise he will screw us. And availability of the resources, what we are having, where we are working, whether it is a remote area, whether it is your corporate area, in a government institutes. And one more thing is cost effective. Definitely it will make a sense or make a choice, the cost is definitely will alter your choice of anesthesia, whether it is going to regional or this thing. And other associated things also which have the position related complications and analgesic dose or pharmacy which is required and hospital stay and at most last safety and efficacy of the entire procedure. It will also make a decision in your mode of anesthesia. In this thought process, there is a lot of studies that came in for, to suggest the renal anesthesia and PCNL. In that way, S. Mehrabji and published it in 2010 in Medicine Urology Journal that he has only studied only regional anesthesia, the results and complications of spinal anesthesia in percutaneous nephrolithotomy. In this study, The intraoperative and postoperative anesthetic and surgical outcomes were evaluated in 160 consecutive patients. It's entirely done only in the regional anesthesia only. The results are in turn, the returns of the sensory and motor activity took almost 142, roughly 128 minutes respectively, and 18 patients developed hypotension, which was controlled by ephedrine 10 mg intravenously. 10 patients, that is 6.3% of needed blood transfusion, and 6 patients were complaint of mild to moderate headache, giddiness, which is normally adult in occurs in any other regional anesthesia and this was settled within 2 to 4 days after operation, which is improved by analgesia and bed rest. And 70% of the patients had complete clearance of the calculus with significant residual calculus after following up the ultrasound. And at the conclusion, they concluded that spinal anesthesia is safe and effective for performing the PCNL and is a good alternative. First time they are told that good alternative for the general anesthesia in adult patients. Same like that in other studies in consecutive years in 2012, 2011, they are compared with combined spinal epidural anesthesia and only epidural anesthesia. They are compared with for the PCNL, and they concluded that PCNL under combined spinal epidural is effective and safe as PCNL under GA, and patients who is undergoing PCNL under combined spinal anesthesia having less analgesic dose and there is a very less hospital stay. And in compared to the epidural analgesia, the conclusion was regional epidural anesthesia is an alternative technique for the PCNL, which achieves a more patient satisfaction and less early postoperative pain and less adverse effect, which is caused by the other modalities, other drugs which is used in the general anesthesia. And the same, same Rubaraji, once again he was, initially he was studied only in general spinal anesthesia. Once again he was published a paper in consecutive years in the general anesthesia versus spinal anesthesia in this same PCNL. In this, he was taken a 110 patients in 2 groups. In equal groups, and he was done, group 1 is general anesthesia and group 2 is in spinal anesthesia. In this, the intraoperative hypotension and postoperative headache and low back pain were more in the spinal group, and there is comparatively with a significant p-value of p less than 0.05. And there is no neurological complications was observed in the both groups. But the need to the narcotic medicines on the day of operation in the group 1, group 2 was 12 and 70.8. It is need for the narcotic medication in the day of operation was less in spinal anesthesia. And the cost is also comparatively both the things, it is $23 in the general anesthesia, and it is only comparatively $4.5 in the spinal anesthesia. So in conclusion, he told that spinal anesthesia was when combined with bupivacaine and additive of fentanyl, it is safe and effective, and it's cost effective for the PCNL surgery in adult patients. One more study which is done in the Tongji Medical College, Wuhan University of Science and Technology in the Wuhan, China. It is a huge study, meta-analysis was done. In that, the material was collected from the PubMed, Embase and Cochrane Library and the Web Knowledge Database. And after literature screening and data extraction, the meta-analysis was done. And by 8 randomized control studies and 6 non-randomized control studies involving is a huge number of patients, 270 patients. In conclusion, that they told that patients receiving regional anesthesia were associated with very short operating period, and their analgesia requirement was very less, and shorter hospitalization with a significant, all these 3 points are very significant p-values, and there is a less blood transfusion chances compared to the general anesthesia patients, and potential complications like fever, postoperative complications, nausea, vomiting also very, they find that very less in spinal anesthesia, but whereas more intraoperative hypotension is obviously present in the, when compared to the general anesthesia. So in conclusion, they told that regional anesthesia is relatively low cost, which is about 4 times cheaper than the general anesthesia when compared to that, and regional anesthesia provide a greater advantage in preventing the pulmonary and neurological complications during the position and shifting and subcostal puncture, as patient can follow the verbal commands and can control the respiration also. So these things facilitated the authors to try a series of series of studies on local and regional anesthesia methods, such as intrapleural blocks, renal capsular blocks, and peritubular infiltrations, epidural analgesia, and so and so. So they told that reduced blood transfusion may be because of lower thoracic pressure during the surgery and decreased blood pressure and vasodilatation following the sympathetic block. So the shorter operation time in the in the spinal anesthesia can inhibit the stress hormone response also better than comparatively the general anesthesia. So in conclude that the PCNL under the regional anesthesia is quite safe and maybe even safer than the general anesthesia, considering the significant less major complications. And in addition, regional anesthesia is yielding the significantly shorter hospitalization duration, and which may be due to lesser pain and major complications. So this is also one of the major study done very recently in the 2022, published in the Journal of Cardiovascular Surgery, done by Abhinav Rao and Abhishek. They are also having the compared this study of comparative study of general anesthesia and subarachnoid block in patients undergoing PCNL. They taken the 100 patients and divided into two groups, Group A and Group B, and the parameters such as hemodynamic variables, intraoperative blood loss, intraoperative mean arterial pressure, and heart rate was recorded. And in comparison, the Group A, Group B, the parameters which compared was duration of the surgery, volume of irrigation fluid used, and change in the HB, preoperatively and postoperatively, and blood loss, and average size of the stone. All are compared in the Group A and Group B, but Group B, which is underwent spinal anesthesia, having with good p-values, they are concluded that it is better in the regional anesthesia. And they are also compared the intraoperative heart rate and mean arterial pressure. All are considered in 5 minutes to 90 minutes in both studies. Group B is having a good p-value, and they are told that it is a better option is regional anesthesia. Even in visual analog score is also a good in Group B. That is in conclusion that in patients undergoing percutaneous nephrolithotomy, subarachnoid block is an effective and safer as general anesthesia. So this study is also very recently taken. These people told that finding the optimal anesthetic technique during the PCNL for renal stone disease, a comparative general and spinal and combined epidural anesthesia. They had taken these based on the three groups. The groups are based on the anesthesia where made by Group A is general anesthesia, and Group B is spinal anesthesia, and Group C is combined spinal epidural analgesia. So intraoperative variables included are heart rate, blood pressure, operation time, analgesia adequacy was noted, and postoperative pain level, hospital stay, stone-free rate, and complications, patient and surgeon satisfaction also recorded. So intraoperative heart rate and mean blood pressure was higher in Group A and Group B. Of course, hypotension was more frequent in Group B. And operation time, hospital stay, transfusion rates, and the stone-free rate was, and all over the patients were satisfaction in similarly in having both the groups. But in Group A, patients experienced more post-procedural pain. So that, and nausea, vomiting, and shivering episode is also higher in Group A. Postoperative headache was higher, but not in non-significant in Group B. So on overall conclusion, that they told that combined spinal epidural anesthesia appears to be a superior alternative to the both subarachnoid anesthesia and general anesthesia with an additional adequate postoperative comfort. So this is also very recent study which is done in the SRM Medical College Hospital Research Center in Poteri by Dr. Kshirabdi Shankar and Kupuswamy. They are also having a prospective randomized control study. Hemodynamic parameters were taken, and postoperative analgesia requirement and incidence of the blood transfusion was recorded and analyzed. In conclusion, they told that patient was underwent percutaneous nephrolithotomy under combined spinal epidural analgesia, had a less mean arterial pressure and comparable heart rates, and required less blood transfusion chances, and postoperative analgesic requirement when compared to the general anesthesia was very less. So in summary, regional anesthesia when compared to the GA for the PCNL, it is safe, effective, and less adverse effective, and complications were very less, and comparable surgical outcomes, that is stone-free rate was very good in regional anesthesia. The less post-operative pain and less analgesic requirement is one of the good factor, and at most patient satisfaction is also very much countable, and it is more cost effective when compared to the GA, and the hospital stay is also very less. And here, in conclusion, that it is not of regional anesthesia, it is not of general anesthesia. What I would like to say is, it is your decision of is important while seeing the patient. It is not of seeing this one. When you are standing in the theater in front of the patient, you have to observe, you have to take. It is ultimately that is counts in your practice. Thank you.